It's the beginning of the year. So many people are asking me about GLP-1 injections for weight loss, and so I thought I would make a video about it. So what medications are we talking about? These GLP-1s are Ozempic, Wegovy, Mounjaro, and zepbound. Here's a quick FDA-approved indications for each medication. As you can see, Ozempic and Mounjaro are approved for patients with diabetes, while Wegovy and Zepbound are approved for weight loss. Ozempic is approved to reduce cardiovascular risk and slow kidney disease progression in adults with type 2 diabetes who have established cardiovascular disease and/or chronic kidney disease. GLP-1 medications work by copying a natural hormone in your body that helps control blood sugar and appetite. They help you feel full sooner, slow how fast food leaves through your stomach, and signal to your brain that you have eaten enough. So you eat less and feel satisfied longer. At the same time, they help your pancreas release insulin, which then reduce sugar release from your liver and improve blood sugar control. So in clinical trials, we have seen that Wegovy can produce as much as a 13% weight loss, for Zepbound as much as 20% weight loss. So these medications are very effective. However, it has to be done in conjunction with lifestyle changes, good nutrition, and regular exercise. Because what we're seeing with people who are losing weight rapidly is that they are also losing a lot of muscle mass. There is no way you can only lose fat mass and not muscle mass. In clinical practice, I do see that some people who are on Wegovy are not losing weight at all because they are not working on their nutrition and exercise. When we take people off of this medication or insurance decide to discontinue coverage, what we see is that most patients are gaining their weight back within the first 2 years and even more. And when they gain the weight back, they gain more fat mass than muscle, so they end up with a worsening body composition, and also their metabolism gets worse. Therefore, the first and foremost, my non-negotiable for starting people on this type of medications is that they need to work on their nutrition and do resistance training to maintain as much muscle mass as they can, as that is the biggest predictor for longevity. Nausea, bloating, constipation, or diarrhea. These medications are not recommended in patients with a family history of medullary thyroid cancer or a history of pancreatitis. Now, when you see your providers for this type of medication, even though your providers are the one prescribing the medication, they cannot dictate whether or not it is approved by your insurance. Your insurance actually determines the coverage, and it also based on what plan you have, and if you are under an employer plan, whether your employer had selected to cover weight loss medication. So if you are thinking of getting on a GLP-1 for weight loss, before discussing with your provider, it would be very helpful to call your insurance plan and figure out if weight loss medication is even under your coverage.